Yes, and have you been pinged by the NHS app? If not, it's very plausible you know someone who has. The app in England sent a record 520,194 alerts last week, instructing users to quarantine for up to 10 days because they had been in close contact with someone who tested positive for the coronavirus. That, by the way, is roughly 1% of the English population. Now, as you can see here, the number pinged is at the highest ever, up 46% from the previous week, which is already the highest ever in that week. And bear in mind, this only goes up to the 7th of July. So pre the big England matches, the test and trace service running parallel to this similarly saw a 42% increase in cases that they were investigating in the same week. And there's absolutely no doubt about why any of this is happening at all. The virus, unfortunately, is very much on the rise. These figures are for the whole of the UK, but you can see we're back up to about 50,000 cases a day compared to what we were seeing back in the midwinter. This is the highest level since mid-January. Some good news, though, is in Scotland, where cases have peaked and now started to come down. But all of this is putting a strain on two things. First of all, on business. We've heard from companies like Nissan, Iceland, like Rolls Royce, all saying their operations are deeply struggling under the burden of employee isolation. Now, from August the 16th, the government has said that in England, close contacts of COVID-positive patients won't have to self-isolate, though they still will need to be tested. But for many businesses, that is a long way away.
We have a recruitment agency in luxury retail, and we have 200 agency staff members. And currently, 100 of those staff members are currently isolating because of the app. And obviously, that's making things very, very difficult. My concern is that infection rates are rising. Potentially we get up to 100,000 infections per day over the next 3 weeks. And that is concentrated in the younger population, which obviously our workforce is predominantly made up of. And then we get left with no workforce, and then the shops get left with no workforce. How are we going to run these massive businesses? It's going to be impossible.
The other element which is struggling is the testing system itself. Take a look at this. This shows the average waiting time from taking a test to receiving the results for home testing kits. And as you can see here, it's been creeping up quite sharply. And as a result, only 40% of home test results were received within 48 hours in the last week for which we have data, compared to 54% in the week before that. Testing centre results times, if you're going in person, have also slowed sharply. And if you talk to people in Whitehall, this is what they're worried about. If cases continue to rise as restrictions fully come to an end, there will be more demand on testing capacity than ever, especially as we get into the autumn and winter. Here is the number of tests that we're doing. This line, the blue line here, that's capacity. This is the number of tests that we're doing, the purple line. Now, as you can see, there's give there. There's about 200,000 of spare capacity. But officials, as I say, are worrying if it will be enough. But the good news, for the moment, is that numbers in hospitals across the UK, actually in hospital at the moment, is still, as you can see, very low indeed, albeit creeping up a bit and is higher in certain places. That said, of course, the NHS itself is not immune to the self-isolation problem, making hospital life, working in hospital, dealing with those patients and that enormous backlog we know about, very difficult. In every sphere, in other words, this is now a question at the heart of something ministers say that we must do, live with the virus. And at present, we're clearly not doing so very successfully.
Thanks, Lewis. Well, joining me now is Steve Bush, National Officer for Automotive at Unite, the union. Good evening. How much of this are you hearing? How much of a problem is this with the workers that you represent in terms of being pinged, not being able to work, but also factory lines coming to a halt?
Yes, well, good evening. We're hearing a lot of stories, a lot of messages are coming through. I'm receiving a lot of calls, not only from our members at Unite currently, but from CEOs, vice presidents, operations directors around the country, not only within automotive, but also the manufacturing cluster. The stories that we're hearing are quite worrying. I believe we're potentially hours, not days or weeks away from our first temporary closure of sites within the UK. And also, one message was conveyed to me yesterday from a senior figure within a well-known global company. And the message from them was, not only, Steve, are we looking at a potential closure, a temporary closure, we're actually going to see, whilst we have them closures, a loss of contract and a loss of contract to China. And as a result of that, potentially, the natural answer to that would be, moving down the line, a potential headcount reduction. And that's something we certainly don't want to see.
Just on the point around hours away from processes stopping, from closures, temporary closures, in cars or in other industries, can you give us some specifics?
Yeah, certainly. Well, look, so I primarily deal with the automotive sector, so I'm touching upon OEMs within the UK and also Tier 1 and Tier 2 suppliers. We have then got engine manufacturers and producers, so they're included also. So primarily, I'm talking about automotive. However, I am hearing from colleagues within Unite, within the manufacturing cluster. It's similar stories.
So tomorrow, I mean, you're saying hours. Are we saying tomorrow it could shut down?
Well, with some of the figures that I'm aware of from conversations we're having with industry leaders, with some of the figures we've currently got, if they're to go further north, yeah, absolutely, we could be hearing from as early as tomorrow that potential stoppages, yes.
What are you calling for in terms of the people you represent? Because the support, the financial support for those individuals when they get pinged and they have to go home is not where it should be, according to some key figures in this.
Yeah, absolutely. And I want to be clear as well, we're not criticising the track and trace. It's a mechanism that's in place to highlight potential issues on the horizon. However, we're highlighting, is there any unnecessary isolating there? Are we getting to a position where people are going to delete track and trace app? And because we certainly don't want to see this as a nuisance app rather than infection control. What we're looking to see is, we're aware of potential test case for the government, one of our senior OEM manufacturers within the UK. And we understand that trial that's been taking place for a number of weeks now has been very positive. We understand that from that trial, if you're pinged, you don't take automatically up your 10-day isolation. You take a lateral flow test. If it proves negative, you continue your day-to-day activities, your family activities, your normally family life and work. That allows us surely that's a mechanism to allow the economy to open up in a sensible manner.
So specific testing to allow people to know very quickly whether they need to isolate or not?
Well, yes, absolutely, because that's the trial that's currently on place, and we're hearing that it is working. It's positive and it's working. And also, we also want to stimulate the debate, and that we're pleading with government. We've got industry leaders calling the union, calling Unite, asking us to support them. This isn't about Unite and the trade unions having a voice. This solely having a voice. This is about working with industry leaders to provide, to ensure jobs continue. We've not lost jobs elsewhere, abroad, and that our members continue to work in the highly skilled and highly well-paid jobs that we've got within the sector. Our sector within the automotive sector is going through a transformation as it is. We've just transitioned. Yes. We've got to ensure these jobs are kept. We cannot afford to lose it. So we're just calling on the government, forget the 16th of August. The message is loud and clear. 16th of August is too late for this industry. It's too late for manufacturing in the UK.
And we're going to have to leave it there, but to remind people, Steve Bush, thank you for your time. From the 16th of August, if you are double jabbed, you do not need to isolate. And you're saying that's too late. We asked the government to come onto the programme tonight, but they declined and sent this statement from a Department of Health and Social Care spokesperson. The NHS Covid-19 app is doing exactly what it was designed to do, informing close contacts of someone who has tested positive for Covid-19 that they are at risk and advising them to isolate. As cases continue to rise, it is vital people are aware of their personal risk so they can make informed decisions on their behaviour to protect those around them.